Several years ago, Myrna Smith's doctor noted a heart murmur. She consulted with a St. Luke's cardiologist, and it was determined she had aortic stenosis.
Murmurs can change, and some murmurs are benign. That's why these patients had this murmur for a long time. But sometimes if the murmur changed, or if they have severe aortic stenosis, then this needs to be addressed and reevaluated with an ultrasound.
Aortic stenosis is a condition caused by a narrowing of the heart's aortic valve. When the valve narrows, it does not open or close properly, making the heart work harder to pump blood throughout the body. Eventually, this causes the heart to weaken and function poorly, which may lead to heart failure and increased risk for sudden cardiac death.
I couldn't walk, 2 blocks without being just totally exhausted.
UnityPoint Health St. Luke's Hospital is the only Cedar Rapids hospital that offers a procedure called TAVR, which stands for transcatheter aortic valve replacement.
It's a procedure where we use the groin in order to introduce a catheter through the groin artery. From there we can reach the valve, and we don't remove the patient's old valve. We place a new valve inside the patient's old valve. This new valve is mounted on a stent that will expand, and it will crush the old valve leaflets against the aorta and use them to anchor itself in place. So we don't have to stop the heart. We pace the heart for about 10 to 20 seconds longest, and there's no open chest, there's no artificial heart and lung machine going, and the recovery is very fast. At least a third of the patients go home the next day.
In the year that I've had it done, I've felt really good.
Within seconds or minutes of placing the valve, it's amazing how you see this heart chamber, this left ventricle, get stronger, literally in front of you in the room. That's one of the most amazing things we see in this procedure.
I have just improved tremendously. The last year has been good.
The second most rewarding part is when literally the next day the patient, or sometimes the same day if it's a morning procedure, by the afternoon the patient is walking in the hospital on the floor and telling us, I feel like 100% better, I feel like I'm a brand new person.
Sometimes I don't even like to talk about it because it's gone so well.
We really are very proud of what we're doing here in Cedar Rapids. We're the only program in Cedar Rapids performing this procedure. Patients here in Cedar Rapids do not have to leave Cedar Rapids for this procedure.
UnityPoint has brought a lot here, and they continue to bring and improve. And if anybody needs a cardiologist, that's where to go.
If somebody has severe aortic stenosis and they're being referred outside the community for a procedure, they need to call us first, because I really truly believe that there should not be a case of severe aortic stenosis that St. Luke's Hospital is not able to treat with outstanding outcomes.
We invite you to learn more about St. Luke's Hospital Heart Care Services and the TAVR procedure.